Hello, and welcome to Sostento Live. I hope you're all doing well. Thank you for joining us today. I am Joe Agoda, your host. I am the CEO and founder of Sostento. We are a 501c3 with a mission to help frontline healthcare workers save lives. I know we have a lot of frontline health workers here watching right now. And, Sostento exclusively serves frontline health workers that, care for patients that are living below the poverty line, our most vulnerable and marginalized populations. So if you are here in the chat, please put what organization you're working for, what location you're joining us from, the name of your clinic. I know we also have some supporters of Sostento as well of frontline health workers. So please, put your name, your organization, and where you're joining us from in the chat. If you want to comment and you're in the YouTube right now and you aren't able to, what you're going to have to do is sign into a Google account. So FYI, that's one thing you'll have to do is sign into a Google account to comment. So see, we've already got Janine, who is the director at our Oklahoma free and charitable clinic population. Let's see, we've got Rachel Jennings from Ethne Health in Clarkston, Georgia. Hey, Rachel, how you doing? I got to visit Ethne back in 2021. That was great. Yolanda is joining us from the St. Vincent de Paul Charitable Pharmacy in Madison, Wisconsin. Near and dear to my heart. I went to school in Madison, Wisconsin. We've got Sheep Health. How you doing, Andrea? Thank you for joining us. Andrea's from the Way Free Medical Clinic located in Green Cove Springs, Florida. Welcome. So many people. Wow, the comments are coming fast and furious. So I don't know if I'm going to be able to call you all out right now, but let's do one more here. Let's see. I saw someone. Oh, Ibn Sina. These are Dr. Hinna. Hi, Dr. Hinna. How are you doing? From the Ibn Sina Foundation in Houston, Texas. We have so many different clinics from all around the country joining us. Welcome to all of you. It's good to see you all here. Let's talk. What is Sostento Live? What is this all about? Well, early in the pandemic, in late 2020, Sostento started a webinar series. The webinars were hosted on Zoom, and they were for a small group of clinics and state associations of clinics, and we would come together each month, and Sostento would provide information, We would bring on leading voices to talk about critical information. We'd also have clinics on to talk about best practices during that very uncertain and evolving time when COVID, there was so much doubt about how we should be responding to COVID. And so we started that in the end of 2020, and we continued to do that all through 2021 and into and almost to the end of 2022. Every month, we would have these Zoom webinars. And not only would we share information, but if I remember, it was also time that we came together and realized that we weren't alone in the fight. It can be so isolating when you're fighting COVID in your clinic or you're a health worker, and yet we would come together, we would listen to music together, we would share experiences, and that would help us feel a little less alone. So at the end of 2022, we experimented with some live versions of those webinars, and we called them Sostento Live. And so we did a few of them last year, and we had a really great response. And so we've decided we are going to continue to do Sostento Lives this year. So I'm very excited. We'll have a series of Sostento Lives this year. And what I would add is that when we, reflecting on how this has evolved, when Sostento did its first webinar in 2020, we had 3 staff members. Today, Sostento has 20 staff members who are every day working as hard as possible on our mission to help frontline health workers save lives, providing them with tools and services and resources. So I want to shout out the Sostento staff that are making me look good today on this webinar and who work tirelessly for the frontline health workers. So thank you to the Sostento staff. And this brings me now, before we get to our 2 amazing guests who are in the waiting room here, so we're going to bring them on soon, is the big question that we are going to talk about. Is the pandemic over? This is the big question I want to start with. And late last year, I started asking myself, is the pandemic over? Because a sizable portion of the population, if you were to ask them, the general population, is the pandemic over? They would say, yes, of course it's over. If you listen to the mainstream media, you hear from some of our politicians, you would also think, well, maybe it is over. Funding for COVID response has all but dried up for community response. And so that's another one to say, well, maybe the pandemic is over. But for Sostento, before Sostento was ready to say, is the COVID-19 pandemic over? We had to talk to our frontline health workers. And over the first 3 months of this year, I've been talking to frontline health workers across the country, and the answer is a resounding no. The pandemic is not over. COVID is still affecting daily services for our frontline health workers. And these clinics are working as hard as possible to understand what they're supposed to do for the long term to battle the virus. And so there's still uncertainty and doubt. I'll give you an example. I spoke with a clinic that is working to renovate their waiting room so that when they have an individual that comes in, they can screen them before they enter, their temperature, if they have symptoms, and they want to be able to have a quarantine zone in their waiting room. And so they are working to get these renovations done this summer because they know even if the federal government is ending the public health emergency, this is still something they are dealing with every single day, potential COVID patients coming to their door and how to handle it. I had another clinic tell me that what they're going to be doing is if an individual is screened at their door of having temperature or symptoms, they right now have no better idea than to send them back to their car. And so we cannot say that this pandemic is over, given the uncertainty, the doubt, and the impact for our frontline health workers. So if you're a frontline health worker, you work in public health, if you work at Sostento, then no, the COVID-19 pandemic is not over. We cannot say that until the virus is seasonal. We hope there won't be another variant, but we know that that could happen. So until it becomes seasonal, until it becomes predictable, and until we're ready for the long term, Sostento would say that if you were to argue the pandemic is over, it would be like a 5-alarm fire saying, okay, that fire, it's out. The fire is out, but behind them, the embers were still burning, and the homes around those embers were not fireproofed. That is what it's like. And I'll tell you, I'm not the only one worried that we're not prepared and that this pandemic isn't over, because recently, in the past week, Bill Gates released an opinion piece on the New York Times entitled, "I worry we're making the same mistakes again." And his argument is that the WHO, the World Health Organization, needs to create a global pandemic firefighting force. That before we move on, before we say this pandemic is over, he wanted to see a global firefighting pandemic force launched by the World Health Organization. And I thought it was a very impassioned plea, but I thought Bill was missing one very important point. He talked about what was going on around the world, but he did not talk about what was going on in his own backyard here in the United States. When we talk about a pandemic firefighting force in the United States, here, I know a lot of you in the chat, that's you, our free and charitable clinics and our safety net health providers, you are the firefighting force on the front lines of the pandemic still. And folks like Bill Gates needs to bring attention to all of you, and we need to recognize more funding, more awareness, and more resources needs to go to our front line here in the US. That's our free and charitable clinics and our safety net health providers. So now, before we get in one moment to our two guests, pandemics are finite. So at some point, the pandemic is going to be over. So what will it take for us to say here at Sostento that we think the pandemic is over? And the WHO had a really good thread on this from their head of infectious disease, who talked about what it would take to get to the end of the pandemic this year. So number one, what we need to see is that part on the COVID side, that it becomes seasonal. If we don't see another variant by the winter and we see a spike around Thanksgiving and into the new year, that we could say, okay, maybe COVID has become acting endemic, which means it's predictable and it's seasonal. However, the other part of a pandemic is that it can't be disruptive in a daily basis. And for our frontline health workers, for it not to be disruptive on a daily basis, the WHO outlines a few points that I wholeheartedly agree with. Number one, there needs to be access to life-saving tools for COVID in an equitable manner. Equitable access to life-saving COVID care, which means testing, vaccination, and treatment, and that includes long COVID. We need the plan to continue to address misinformation, disinformation, and the politicization of the virus. And we need to do the preparedness work. We need to get prepared so that if another variant, if another threat, COVID or another virus comes, we are ready. And so we can't let down our guard. We can't dismantle systems. And I believe, however, if we put in the hard work and we get ready and we do our side of it, and COVID does not come back in full force with a new variant this year, we have the power to see the pandemic over. So that is what I believe it will take to call the pandemic over. However, we have to also live in the reality that the federal government here in the United States is going to be ending the federal public health emergency on COVID May 11th. And so now we're going to talk to two guests who are going to help all of you frontline health workers who are here prepare for that moment. And our first guest is going to be Dr. Nathan Chomilo. I'm going to bring him on in just a moment. He is the Medicaid medical director at the Minnesota Department of Human Services. He's also a practicing general pediatrician. I met him virtually at the White House Summit on COVID community response. He was all over social media with amazing takes, selfies with all the important people there. And I said, I have to talk to this guy. I was able to talk to Dr. Chomilo, and I think he is great to give us the perspective for Medicaid patients, what's going on in the health system. And so he also actually was the COVID-19 vaccine equity director for the state of Minnesota. So he has a great perspective on this, and he's going to help give us some key insights so that we can prepare for this end of the federal public health emergency. So further ado, let's bring on Dr. Chomilo. Hello, Dr. Chomilo. Thanks for joining us.
Yeah, good afternoon, Joe, or at least it's afternoon where I'm at.
Excellent. Well, let's get right into it. We don't have much time with you. So tell us about how you see the impact for the end of the COVID public health emergency on the safety net, and in particular on individuals who rely on Medicaid. What should providers know about how this is going to affect those who are on Medicaid?
Yeah, I think the primary thing, and hopefully folks have started to see many of the articles and coverage about the fact that in some places it's already started, and certainly starting in the next weeks and months, all Medicaid state agencies are going to have to renew and re-enroll everyone on their programs. When the COVID-19 pandemic hit, the federal government put in place policies that gave states more money if they kept people on, because they didn't want folks losing access to healthcare in the middle of a pandemic. Makes a lot of sense. And so part of the appropriations bill at the end of 2022 said that states are now required to go back to how they operated prior to the pandemic and the public health emergency. And that means that we know that there's going to be millions of people who lose their Medicaid coverage, lose their healthcare access. We know that many of those will lose it because of paperwork, because of red tape, not because they actually aren't eligible for the programs. And we certainly have looked at the data here in Minnesota. That's roughly 1 in 5 of our enrollees who will have a period that they lose coverage and then be back on our coverage, within several months once they figure out all the paperwork. But during that time, who knows what can happen? And I think that's the big issue, is there's going to be access issues for millions of our fellow neighbors across the country. There's a financial risk here too. We know that when we saw the expansion of Medicaid through the Affordable Care Act, that bankruptcies decrease. And you can imagine that if you think you have healthcare coverage and you go into the emergency department to get something taken care of, or even just a regular doctor's visit, and then several weeks later you get the bill without any coverage, that's going to be a big issue for a lot of our neighbors and community members who are living paycheck to paycheck, or might not have as much access to take a hit of a doctor's bill. And then we're talking to a bunch of our safety net clinics and hospitals. That's going to impact their bottom line too, because there's a lot of folks who will be dropped off, and so when they send that bill to the insurance company is going to send money back to them. And so they have to figure out how to plan and navigate that to continue to provide the care our community members need. But how do they make the financial side make sense when there's so many more folks who don't have coverage?
So you've hit at what I've heard from our free and charitable clinics that Sostento serves, is that their biggest concern is this unwinding that you said 1 in 5 current Medicaid could become uninsured. And when an uninsured individual often may end up at a free and charitable clinic looking for care. And it's a state-by-state, approach to getting the re-enrollment. So maybe you can speak a little bit to what you're doing in Minnesota to help make sure that the unwinding goes smoothly.
Yeah, we're trying hard to kind of learn the lessons that COVID-19 has taught us, and as we've engaged communities to try to get information out about the virus, about keeping themselves and their families and community members safe, how to get access to tests and masks and then vaccinations. How do we use some of those same levers to let folks know that they will have to renew for their Medicaid coverage? And then if they don't qualify, how do we make sure that they have access to other insurance options that we have available in our state as well? And so we've had community forums to listen to not only our clinics, but our navigators who help folks sign up for coverage, listen to our counties, our health plans, to understand where are some of the gaps. A lot of the issues around re-enrollment and what is called churn, folks falling off who are eligible and then having to come back on. That's been known for years. And so, we were able to kind of not have to navigate that with the continuous enrollment clauses, but what can we now look at and really target as far as, are there things about our application? Are there things about making sure that, I think there's workforce concerns certainly on our navigators who have had their model of getting funding challenged because they really do require folks to need enrollment. And so a period of time where there wasn't a lot of enrollment, we saw our navigators express they had trouble just maintaining their own staff. And so how do we help build up their staff? How do we help build up the staff of our counties? We're a county administered state. And so they are really crucial in making sure that when folks go to get their coverage renewed, that they have the staff that can help folks navigate that. And so I think a lot of it is just technical pieces. And then on top of that, getting the message out consistently, because unlike the vaccination or testing or other pieces of COVID, where if we are able to educate folks and they're all right, I need to get a mask, I need to get a test, I need to get a vaccine. This is a little more tricky because it's going to depend on when they enrolled, and so we could get the word out to folks, but they might not actually be up for enrollment for several months. And so how do we kind of stay constant, and so people know that when that letter comes, they know where to go and where to have access to it. And we're really trying to work and situate ourselves so that there are those consistent touch points, that we're going to people, not making it so that people always have to come to us to figure out how to maintain coverage. And then we're looking at our data in the ways that we looked at during COVID-19. We have a public dashboard that folks can access to see how we're doing with re-enrollment, looking by things like race, ethnicity, looking at things like geography, including looking at social vulnerability index of our zip codes. And so that's something that folks can use to plan their own efforts, and also to kind of help us stay honest and keep us accountable to where we should be maybe shifting resources throughout what we plan to be a 15-month long campaign.
So you use the new word for me, a technical word, but I think it's important, is you talked about churn. And churn, from what I understood, you said, Dr. Chomilo, was when an individual has to re-enroll, there may be a period where they're not having insurance, and that's the churn period. And we know that if a lot of individuals churn at once, there may be even more that end up in this zone where they are eligible, but they don't have the coverage. And so I guess that's one thing, but that the churn isn't different. I also heard you say the churn is something that we've seen before. So if you're a free and charitable clinic here and you're wondering about, is this different, this re-enrollment process, it sounds like it is the same, that it is similar to the churn that maybe we saw before the pandemic. And what you also said, Dr. Chomilo, is that to prepare, it's all about what we learned during COVID around education and communication, is that individuals will need to be educated and communicated with about their re-enrollment need, their status. And I know, one last thing before we move on, I know that you said that you really fought hard, that the one way maybe the churn is a little bit different this time is before that notification that you were coming off of Medicaid was only by mail. And that now that has to be done by mail and an additional, way. So I guess maybe my last question on this component, what we go to the next part of this is, what would you say to someone who's in that churn? If some of our providers are like, hey, someone's in this churn, what should the individual be looking for? What do they need to do to get re-enrolled in their Medicaid? What advice would you give them?
Yeah, I would certainly be looking toward, because as you said, it is a state by state campaign. And so really making sure you're following with whether it's the Department of Health, Department of Human Services, who administers your state's Medicaid program, on the information they're sending out about the timing of renewals, when they're going to start sending notices, how fast do they plan to have everyone renewed. Again, what we said, ours is 15 months. There are states that are looking to try to renew everyone in 6 months, right? And that's going to look a lot different and probably lead to a lot different outcomes in who does and doesn't maintain their Medicaid insurance, regardless of if they're eligible or not. So I think being real in close contact with them, so you can then help guide your patients and your community members. Here's the website to go to update your contact information, for example. There's lots of states, Minnesota included, ours is a Renew My Coverage, where you can go and find information on how to update your contact information so that you do get that letter, because people have moved a lot in the last 3 years, right? And might not have the most updated contact information for us to send that letter, or send a text message, via your phone. And then, I think that those are going to be kind of the key things, is like making sure you're on top of what it looks like in your state. What are the resources for folks to go to? What are Navigator organizations doing? If you're a county administered state, what are your counties doing? How are their health plans engaged and offering support? I think there's a lot of folks who are paying attention to this who haven't traditionally paid attention to re-enrollment in Medicaid, which is a good thing. And so, hopefully we can, again, continue to learn lessons from this campaign, continue to do better, even beyond these next 15 months.
So you heard from Dr. Chomilo. If you're wondering, look at your state. What is their plan? What, prepare for what the churn that may come, and get yourself educated. So when an individual may show up at your clinic uninsured saying, hey, I lost my Medicaid coverage, but I'm trying to re-enroll, or am I going to lose my Medicaid coverage? Should I be coming here? Go to your state, get informed, and understand that every state has a different plan, but you can be ready to communicate and educate your patients in your community about how they can make sure that they get back on their Medicaid coverage if they're eligible. So, Dr. Chomilo, what else? What else should safety net providers be thinking about that when this public health emergency ends in May? What else should they be thinking about? What else should they know is going to happen when that day comes?
Yeah, I mean, I think as healthcare providers, 3-4 big things, how we get access to COVID vaccines and medications to treat COVID, tests are all going to change over the next, roughly 15 months. Right now, the federal government still has a stockpile of vaccines, of medications, of tests. They've asked for more funding, but there's concerns that with what the Congress is balanced like now, that funding is not going to come through. So once vaccines run out, once the medications or tests run out, we're going to be going back to kind of more traditional mechanisms where you might have issues with supply and demand. Certain populations might get covered. So our Vaccine for Children's program is going to cover that gap for children, but that's not always going to be the same for all adults. And so those costs are going to likely end up being passed on to patients and to clinics as well. And that might impact folks' decisions to whether to access them and use them. And then thinking about telemedicine as well, there were a lot of changes that were rapidly put out to allow physicians to practice across state lines, like in-person requirements for things like substance use disorder treatment or prescribing controlled substances, and then even the use of certain devices, right? So I know in my clinic, we actually were using Google Duo initially for a lot of our telehealth, but now I've had to switch to what's considered a HIPAA compliant device. And so that's, I've seen create issues not just for our system, but for my patients who now have to figure out how to use this different device, different app, if you will, to access telemedicine. So hopefully folks are kind of well aware of that and being prepared. All of these, they did give a window of about basically till September 2024. It's like a year plus a quarter. And so folks do have, the ability to kind of plan ahead, but I think those are things that, along with educating our community members about these changes and that we should be, making sure we're ready to address as well.
And then what advice would you give to a clinic or a safety net health provider who's getting ready to adjust to some of these realities that you just talked about? What advice would you give to the safety net health provider?
Yeah, I mean, I've been a big advocate of really trying to continue those community ties that were built or strengthened during the pandemic. The education is going to be so key, and love what you kind of opened up with about COVID's not over, right? And so how do we keep making sure that we're talking about giving folks the tools to balance those decisions that they have to make with the risks that COVID still presents, and as they navigate things like long COVID or other complications. Continue to do what you can to kind of meet our neighbors where they're at, right? So continue to try to go out into schools, places of worship, barbershops, mobile units, what have you, to really kind of get out there and kind of, as much as you can, continue doing what we did during COVID to get out and meet people where they're at. Continue talking to people like me and legislators about what you want and need to stay and, what's worked, what didn't, that shouldn't, be part of just an emergency response. It really should be part of how we're doing it day to day. And then, I think really chief is how do we take care of each other? How do we take care of our healthcare workforce? Because there's going to be no response if we continue to see folks leave our profession. And so really thinking about what we can do to really take care of each other, take care of our workforce is key.
Well, I think you spoke to a lot of things that resonate with me about meeting people where they are, making sure the frontline health workers are equipped with what they need to continue their response. One of the things that I'm looking back at is that, and I think you kind of spoke to, is that during the pandemic, we tried a lot of new things. We did interventions that I think before people said wasn't possible. We were able to do it because it was an emergency. So are there any kind of equity and access interventions on COVID that you saw were deployed that you hope will really continue on even after the public health emergency ends?
Yeah, certainly. Just from a policy level first, and we opened up talking about the resumption of renewals. I think continuous eligibility is a great idea, and how we can continue moving that forward. In Minnesota, we've put forward a proposal that is very similar to a recent proposal Oregon had accepted to extend continuous eligibility for the first 6 years of a child's life. And so, at any point in the first 6 years, if they're eligible, they stay on eligible on Medicaid until they turn 6, and then extending that to a year for children over the age of 6. Oregon went a step further, which I'd love to see us do as well. They went to 2 years for everyone over age 6 of continuous eligibility. And so I think just, again, trying to address some of these issues with churn, we can kind of continue to improve our healthcare system as much as possible. But if not everyone has access to it, that's going to continue to lead to gaps. I think direct funding to communities impacted by structural racism and inequity in particular, and trying to take away as many of those kind of administrative hurdles and barriers, and how communities decide how funds are spent, and what we define as success, and the metrics and measures that we look for. I think there's a lot of folks willing to finally let go of some of that in an effort to help during the COVID-19 pandemic, and I hope we continue to explore that. And then improvement of our data, looking at our race, ethnicity, language data, using it to guide policy and allocate our resources more directly. In Minnesota, we've used a proxy for race, or structural racism, I should say, called the Social Vulnerability Index, to really try to prioritize where we send things like masks and tests and whatnot. And I really like to kind of see us continue to explore what that would look like with other sources of funding as well.
Something you mentioned is about the continuous coverage for young children to the age of 6. I know you're a practicing pediatrician, so maybe there's even a little bit more you can give to, around, the continuation of anything related to COVID around children. Is there anything that you're seeing, any, guidance or advising you would give around the care of children when it comes to COVID?
Yes, I mean, certainly that first 6 years is critical, because we know there's so much going on with early brain development that really can impact the trajectory of our life and potential long term. And Medicaid, healthcare coverage, your physician's office is such a crucial point of contact that connects you to lots of different resources. And so making sure folks continue to have connections to that. Certainly, vaccination has been a big issue, in making sure that folks are getting their information from the best sources, and not falling prey to misinformation or disinformation. And then I think as we move into our older kids, we are really seeing the impact of growing mental health crisis, right? And what is the impact on folks' ability to do well in school, to function long term, if they aren't getting their needs met for their mental health. And so what can we do as far as identifying that, making sure that we are building up the resources, that the resources are in a way that our communities identify with. I really see this in my own practice, where it's hard to find mental health providers of color that can identify with some of my patients and families about the experiences they're having, and then from there be able to kind of build the skills to navigate them. And so what are we looking to do to kind of help build that infrastructure for our kids? I think there's a lot, unfortunately, the pandemic showed us what a lot of pediatricians know, is that kids are often kind of like the last thought of. And you looked at even like how vaccines were developed, how policies were evaluated. It was kind of, let's take care of the adults first, and then, kids we'll figure out later. And so, I think there's still lots of lessons to be learned about, what worked, what didn't. And I'm hopeful that next time we have a more kid-centric part of our response.
Great. Well, I got one more question for you. Because when I follow you on social media, when I saw you engaging at that White House Summit, one of the things that I was most inspired by when you talked about is the power of partnership between different parts of the health system. And so what suggestions would you have for a lot of these community-based health providers who may be joining us here or watching this video and this stream? How can they maintain and grow their partnerships, even with the end of this emergency? How can they continue to grow and maintain their partnerships, especially with their local and state health departments?
Yeah, I mean, partnerships are crucial to any of the success we had in Minnesota, and really everywhere I've encountered folks who are sharing their success stories. It's been in a partnership. And so, I think from a state's perspective, things that I've seen is organizations that can really help be a trusted messenger wherever they can, really connecting their community members to what health departments are trying to do and have ready to go, and then helping connect other community-based organizations doing that good work, kind of recognizing that this type of work doesn't have to be a zero sum. And so how can we really come to the table together and kind of share those goals and those successes. And then I reflected a lot on kind of how I've seen some folks try to change and be part of the policy decisions and discussions, I should say. And it really made me think about a quote that Martin Luther King Jr. Talked about in his letter from Birmingham jail about folks how it's easier to be a thermostat a thermometer versus a thermostat, right? And so it's a lot easier to kind of read the temperature and tell it, but then not actually have do the work of trying to change it, right? And so really, helping us identify problems, gaps as a state agency, as a local government agency, and then working collaboratively towards that solution. And recognizing that every health department, every local or state agency is on a different path towards anti-racism and health equity. The one I'm working at is on its own path. It's made some steps in the last few years. It's definitely not where I think it needs to be or want it to be. But we desperately need, community-based organizations that are able and willing to do some of this kind of hard, messy, uncomfortable work of coming alongside, showing us, where the needs are, and then helping us, together in a way that hopefully, again, gets us closer to where we all want to be.
Well, I think, Dr. Chomilo, I think that's an inspiring way to end our interview. I know that we have, if you want to follow Dr. Chomilo on Twitter, he's a great follow. I know you put it on LinkedIn, I think also as well. So I know there's some questions for you in the chat. We can send those views after, as well as some comments. But we really, really appreciate you taking time out of your busy day to speak to our audience, to speak to our frontline health workers, and we'll continue to follow, and we'll hope and support each other as we go through this chaotic time of the unwinding. And there's still that uncertainty. The pandemic not being over means that we will continue to see uncertainty, we'll continue to see disruption. But I think, that's why we all need to work together. And as Ratika here says, we thank you so much for sharing and appreciate you coming and providing these insights so we can be up to date with the Medicaid changes. That's Ratika from our team sending you some love, Dr. Chomilo. So I want to thank you for the time. And with that, we will let you go, and we'll continue to stay in the dialogue as we get through this, get this next transition period.
Thank you, Joe. Thanks to the Sostento team, and thanks everyone for what you do for our communities. Take care.
Thank you. Cheers. All right. That was Dr. Chomilo. Very lucky to have him. He's a great follow on social media. I suggest you check him out. So before we bring on our next really special guest, we're going to just take a quick 2-minute break. So if you need to get a drink, you need to use the restroom, go ahead and do it. But during that time, we actually have a survey question that we're going to put up on the screen here for you, which is, what superpower do you think would help frontline health workers better serve their patients? So you can put your answer in the chat. So you can go ahead and put in the chat, what superpower out of these would you like to have as a frontline health worker, or for frontline health workers? Which of these superpowers would you like them to have? And if there's one that you don't see on this list, you can go ahead and give us another superpower that you wish you'd have. So please put that in the chat. But let's see, we got some comments as people are thinking through their answer here. We have Yolanda, who thanked Dr. Chomilo for an enlightening and informative presentation. We also have Sostento's leadership advisors here, who is asking for a more kid-centric approach. All right, now I see we're getting some answers in here, fast and furious. Let's see, in terms of our survey question. So Edlin would like to read minds with our frontline health workers. I'm seeing a lot of read minds, although here Sahaj would like super speed. I think that would be good to see some of our clinic workers, running around. That would be fantastic. But let's see what else we got. A few super speed. Jody says super speed, as well as Sarah's going with X-ray vision. I guess that would save some costs on needing to do X-rays, right, Sarah? That's a good one. Let's see. Alan has a new one, an English translator. I guess that would be a neural implant of some sort there. Let's see what we also got. Juanita would like to move things with her mind. I like that. That's a new one, the superpower for frontline health workers. We think as we have our little break here, these are all great answers. But let's transition. I think that's our 2-minute break. So thank everyone for putting your votes in here. So let's move on and talk and introduce our next guest. Let me take this off for you. All right, our final guest for today, who needs not much of an introduction if you work for a free and charitable clinic, and that is Nicole Lamoureux. Nicole is the president and CEO of the National Association of Free and Charitable Clinics. She has led and been with the association for over 16 years. She's testified before Congress. You may have seen her on a news channel as a TV commentator. She's published many, many articles, and I like to call her the champion of the free and charitable clinic. So we are really lucky to have Nicole. So let's bring her on, Nicole Lamoureux. Hello, Nicole. How are you?
Hi, Joe. How are you? Thanks for having me.
Oh, so excited to have you today. This is a long time coming to have you on one of our webinars or live events. So this is a special moment for me as well. So let's start. Let's just get right into it. What should the free and charitable, actually wait, before my first question, we got some love for you here. Let's see, we got Amelia saying so excited. We're happy to hear what you have to say, Nicole. We've got Ibn Sina. Welcome, Nicole. So good to see you. So we got some love for you in the chat. I'm sure that will continue popping up. But I know they're here to get your wisdom. So tell us, what should free and charitable clinics know about the end of the federal public health emergency in May?
Well, first I have to say hi to Dr. Azam. She's one of my board members, so I'm glad that you're here, and I appreciate you all. And you know that I never start anything, any presentation without saying thank you to all of you at the free and charitable clinics. Thank you for the work that you do. Thank you for how you're giving back to your communities, and thank you for how you responded to COVID. So if you are a member of the NAFC, you know that we've been talking about the unwinding since the president made the announcement, and a couple of things that you need to know. First off, you definitely need to know that according to the Kaiser Family Foundation, there's anywhere from 5 to 14 million people who will lose their coverage. And so I'd love to give that number. That's a very broad number, huh, Joe? When people ask us for numbers, they want us to narrow it down. But so 5 to 15 million people, we're talking about that churning. I'm so glad the previous guest had talked about that. I think that what we're finding at free and charitable clinics is you really need to have some conversations with your board of directors, your volunteers, your staff. You have to make sure that you're understanding what your community needs. As you all know, we don't say the sentence of when you've seen one free clinic, you've seen one free clinic. We say we are the community's response to healthcare, because each of you in each of your communities has a different need, even though overarching, they're the same. We know we're serving the uninsured. We know we're serving the underinsured. We know COVID is an issue. We know chronic diseases are an issue, but we also know that each of your communities were different hotspots during COVID. So one, at the NAFC, we've provided you the top 10 questions that you should be asking yourself. So if you are a member of the NAFC, you've received that as part of your Friday 5, but some of those questions, Joe, I think go like this. Are we going to continue our same delivery model? Are we going to remain a walk-in clinic, or are we going to set up appointments now? Are we going to keep the same protocols in place that we had during COVID? Are they now just a part of the work that we did, or did we decide that COVID was special and that was one thing, and now we have to go back to the way things were? I think it's time for us to recognize that things are never going back to the way things were. I just had COVID last week myself. If you ask anyone here, COVID's not over. We know it's not over, but we also know that the way that we did business as a country and as a healthcare system prior to COVID has changed. So you have to continue asking, what happens if telehealth is not extended any longer and the protections aren't as extended as they were, as the previous guest was talking? What are we going to do at our clinic about that? How are we going to address this? Have we had important conversations with our hospitals? Have we had conversations with our partners yet? Have we asked them where they expect us to fit? Or have we told them where we expect them to fit into this process? We have to be vocal, and we really have to tell our story, not just about what our clinic is doing, but also what is needed for our patients. We've also provided you, as a member of the NAFC, talking points that you can use in your communities to help highlight the work that you've done. And then I think you also have to have your data. You have to have your data ready to tell your stories. Your data, along with a patient story, is a powerful thing. If you ask me about your superpower, that's your superpower. Your storytelling and your data collection is your superpower. I'd like to have X-ray vision, and I'd love to be able to fly as well. But those things are really, really critical. If you can go to your funders, if you can go to your hospitals and give them that information and start those dialogues, you're going to be prepared. So 1, start asking yourself questions if you haven't done that yet. 2, get your data ready and your storytelling ready. 3, have those communications with your partners. And 4, take a hard look at your delivery model. And that can be anything from how long it takes for a patient to get through the waiting room to, like you talked about, how does your waiting room look like? And is that going to stay the same? And then 5, contact the NAFC for us to give you those top 10 questions and talking points.
That's great. I have a follow-up for you there, but let's get to some more comments for you there. Amberly, who's actually a member of the Sostento team, who joined us from a free and charitable clinic in Wisconsin. So thank you, Amberly. We've got Sarah here, who's a big fan, sending you love, as well as Edelyn, who reminds you, if you're a free and charitable clinic and you're not a member, become a proud member of the NAFC. That's Edelyn Fernandez there. So I have a follow-up there, that we're also struggling with here at Sostento, I'm sure the clinics are, which is this balance of short-term need and long-term thinking. Because I feel like you're kind of speaking towards how are we going to start to balance in it that, we can't continue in emergency response mode forever. We just can't. We'll burn ourselves out. Our staff won't survive. And so we need to accept that COVID will continue to be a threat, but we need to start doing that long-term thinking. So what advice would you give to an organization, a clinic, that's like, how do we balance the short-term reality of COVID still a threat, but the long-term, how do we sustain ourselves given that this is going to be around? How would you suggest that thought process?
So I think after over 16 years, one of the most amazing things that I have had the honor of witnessing with free and charitable clinics is that I would say that the clinics have already done that through COVID. They didn't just stop and address COVID. Clinics continue to address chronic disease management and social determinants of health. And I'd say that COVID perhaps became the number one reaction that they had to have at that time, but they had continued through, as we've had conversations with our committees and at our symposiums, and when people come to our webinars, that they've always kind of been thinking about these long-term plans. So I think, 1, remain that flexible, nimble incubators of great thought, as Dr. Darnell says about free and charitable clinics. I'd say that also is a superpower of them. I think that one of the things that as I addressed in my previous statement, is that ability to really see what your response in your community is. That helps you recognize how you're going to have long-term planning. I think that clinics I was so impressed with clinics who on a dime shifted to telehealth. But to be fair to clinics, telehealth had always been part of some of their conversations. It just wasn't something that was the number one conversation that they were having at the clinic. It might have been part of their 3-year strategic plan. And so I think the number one way to get yourself out of that response side of things is a couple of things. The number one thing is to look at those 10 questions we gave you, because they were done with our board. Again, they start with, how are we changing from COVID, all the way to what are we doing in our community and anything in between. 2, I would say, get involved. Those of you who are active on our listserv, I think that's a great place for having some of these conversations where you can talk to other people to understand what they're doing and how they're doing it. Keep coming to events like this so you can have those conversations and hear from experts. But I would also tell you that the one thing I would ask free and charitable clinics to do more, and you all have heard me say this, is I need you to be as active and vocal on these policy calls that I give you. So we have changed our whole advocacy outreach on how you reach out to your members. You type in your zip code, it pops up information for you. We give you a letter and it's sent off. I need for you to do that because as policymakers, state, federal, local level, they need to hear from you. And you need to be active if you have a state association with your state associations, because you're going to get that networking, you're going to get that education, and you're going to get that planning. Future planning for clinics. We also need to start looking at what is the infrastructure your clinic needs to run, not based on your programs. You have to start looking at what is your how many volunteers does your clinic need to run every day? How many staff members do you need? How much money do you need to pay for those staff members? And then you start looking at your programs. And I know that that is such a different way of looking at things. But as we're going to approach funders, we have to start talking to them about how we're not having the tail wag the dog, but that we're telling the funders how we're addressing the needs at the local level and what we need and why we need them.
Yeah, that your answer really resonated with me. I think what it reminded me is that, number one, there were equity issues, social determinants of health that existed before COVID. COVID definitely made them more acute, but we were always aware of them, and we're going to continue to work on them when COVID is over. So some of it is, there is continuity, that you don't have to think short-term, long-term, that there is certain, continuity there either way. And I would add as well that there are things that we learned during COVID does increase access to care, whether it be COVID or anything. We should be fighting to continue those interventions that we know increase equitable access to care. And so then we're able to maybe take that longer view, knowing that short term there are things we need to fight for, but there's the longer term view. We have one more comment here for Nicole, is that people are hungry for those things that you keep speaking of. So if folks maybe missed that email accidentally or they're looking for it, how's the best way for them to get those key things that they need to be thinking about from NAFC? What's the best way for them to get it?
Sure. We'll go ahead and resend them in this week's Friday 5. So every Friday we send out the 5 things you need to know. We'll go ahead and we'll send that, the questions that you need to ask, the talking points, but also I wanted to remind you all that we also sent you other free resources that I just want to highlight really quickly for you. We have a 50-state tracker that tells you exactly where your state is. It's from Georgetown University. They allowed us to share that with you. You can click on your state, understand what their unwinding programs are, what the public health emergency programs are for you. And that way you can find out who you should contact on your local level. We also have flyers that you can start handing out to your community that can be tailored from HRSA, that also you can add your own logo to the bottom of them. So you can make sure that you're talking to people as well. We have toolkits on Medicaid, Medicare, and CHIP, both in English and Spanish. We have documents as well as toolkits for providers, both CHIP and not CHIP, in English and Spanish, and then other resources of articles that you should read. And then myself and our lobbyist actually went through in depth all of the policy issues that you need to be thinking about for Medicaid. We'll add that to the Friday 5 for everyone to get as well. So this Friday, we'll have all of those free resources for you. And again, it's called our Friday 5. If you're not a member of the NAFC, you can contact our offices, get signed up, and you'll have that information as well.
Mm-hmm. Thank you. That is great, Nicole. So let's talk specifically to the unwinding of Medicaid that we talked to Dr. Chomilo about. As you've been talking to clinics across the country and you've been looking at your constituency, what are your recommendations for the clinics who are preparing to deal with this churn we learned about in the unwinding that will be felt differently state to state, but maybe all clinics need to be ready for? Nicole, what would you suggest clinics be doing?
Well, I think there's a couple of things that we need to do. One is take a real hard look at your PPEs first, even before we get to unwinding. Understand what stock you have. And the reason I bring this up is the previous speaker did address it a bit, but the national stockpile is $38 million short of what they had originally talked about. Now, I would remind everyone, and not that our clinics know this, but we didn't receive anything from the national stockpile. So it wasn't as if this was an issue. But it is important to recognize that for the states, they are going to be looking at what the stockpile has. And we need to make sure that the states understand that the first time around, we didn't have any help with the masks as well as with the vaccines. So we can address that later. I think some of the big things we need to recognize is there won't be vaccinations or free tests or those type of things any longer. That won't exist. Now, there are some conversations with Moderna, who is saying that they're going to start an actual vaccine program for the uninsured. We've tried talking to them to see where that fits. But that's the first thing we need to look at is, do you have the stock for those things that you need now? Sign up for some of the free tests if you can. You can get eke in under the wire. We can send some of that information to you. But you also are going to need to make sure that, again, are you ready for people? So that's why we provided you first. Let's get these flyers that help people understand how they can continuously sign up for Medicare and Medicaid, Let's get handing those out. So if you have community health workers going into the community, if you have put them in with your partners, put your logo on it. So you're already that trusted partner in the community. Make sure that you're leading the charge. Again, I know that right now people will say, oh, but I don't see Medicaid patients. Remember that on May 11th, those Medicaid patients are going to be looking for care. So make sure you have your resource lists updated. Make sure that your phone lines are updated. If there have to be changes to your website, make sure that those need to be made. If you're going to change between now and May, or you're in the process of changing your delivery model, say you're now going to see Medicaid people, or say that you are going to want to change if you're going to become a charitable clinic, or you're now going to be open 24 hours a day. I'm just telling you anything to think about, which I hope none of you are going to do. You really need to make sure if there's a change to your bylaws, you have to talk that over with your hospital partners and your funders, and you'll have to tell the IRS. None of those things can just be made in a vacuum, because everything hits something else. How you're answering your communities, how the hospitals will partner with you, what they will give you in the future, and then also how you're going to be funded. And then finally, let's continue to do what we've done for all of the years. And something that I'm so proud of Free and Charitable Clinics for is you've always kept equity at the center of everything you've done. But we need to remember that funders are going back to the way it was, and we are now already in the way it needs to be. So keep that in mind. And again, going back to your data, if you set up a clinic near a bus stop, or if you set up something in your parking lot to address social determinants of health, make sure you have the information on how that served more people, and how you worked on health literacy and rewrote documents to make sure that they were written at a 2nd to 4th grade reading level, and why that quest for health equity is just as important as the work that we did under COVID, if not more so. And that will set you up for a real good future conversation, as well as helping you be set up for responding to the pandemic or the flu or anything else in the future.
That was strong, Nicole. I know that you've been in that position for 16 years. It shows. This is why you're the president and CEO over at NAFC. But one of the things that you didn't mention that I think will have a big effect is the pullback on COVID testing and vaccination. And that's across the board. I think that means more folks are going to show. I talked to a clinic in Milwaukee who said that someone took an over 60-minute drive from Green Bay down to Milwaukee because they had an individual who had an adult child that wanted to go into SUD recovery, but they mandated a vaccine. And the young adult said, I don't want mRNA, I want the Janssen then. If I have to do it, I want the Janssen. It was not available anywhere. This person ended up going to the Free and Charitable Clinic. And of course, because they have volunteers, because they're the safety net of the safety net, some folks say, that they helped arrange them to get that vaccine. I think that pullback across the country is just going to mean more individuals who are not your traditional patients showing up at your door. We saw that during the pandemic. I think we're going to see more of it. Now, Nicole, unfortunately, we're just about out of time. So I guess my main last question to you here is, what does NAFC have planned for this year? Like, what can we look forward to from NAFC, for the Free and Charitable Clinics, from your team? What's in store for 2023?
Oh, well, I think we have a lot in store for 2023. I think the biggest areas, those of you who are members have seen our nice little diagram, NAFC at the center, health equity on obviously in everything we do. So more marketing, PR, more advocacy work, disaster preparedness, capacity building, Member services, education and training will be a big issue for us. And then patient education. I think we've just changed our vision at the national organization. We're now looking for a just society that ensures a healthy life and well-being for all. We have our patients at the center of the work we do, and know that our clinics are the people that are providing them access to that healthy life and well-being. So as always, the members will be our priority, but look for more funding opportunities, look for more advocacy and more training that will be coming from the NAFC. And as always, we're incredibly grateful to do the work that we do for you and for your patients.
Let's get we got the wrong banner. We got Dr. Chomilo's banner up there. Can we get Nicole's information up there, please? So this is follow Nicole. If you want to follow her on Twitter, we got at Nicole L Busby. Is there anywhere else other than Twitter that they can keep track? We've got some nice comments in here. I'll put those up if you tell us where else they can reach you. We got the Light of World Clinic saying thank you, Nicole. NAFC 100. Also Eileen, I know that's one of the clinics we've worked with as well in Pittsburgh. Hi, Eileen. So where else, if they want to make sure they can continue to hear from you and NAFC, where should they go?
I think the easiest place to go is to go to, thank you, Sarah, for popping that in there. Go to our website, nafcclinics.org, and then you'll see the links to all of our socials on there for us to do that. And, Joe, I just really want to thank you and your team for all that you've done for the clinics across the country during the pandemic. And thank you for including me today on this call. It's been a lot of fun.
Yeah, Nicole, I think we have a lot of work to do. We can do it together with these amazing free and charitable clinics on the front line, and we can come out stronger after this. The emergency itself is over. We have work to do at the end of the year, but I think just reconfirms the need for partnership and collaboration. So, Nicole, maybe we'll have you again later in the year. I think we should have you back and see how have things gone. Are we near that end of the pandemic? Maybe we'll celebrate with you if we get closer to it. We'll have you back on.
Sounds great. Thank you.
All right. Thank you, Nicole. All right, that brings us to the end of our first Sostento Live of 2023. It's been very wonderful. Live, anything can happen. We have hopefully had a little fun with us. I want to thank you all for your time and for joining us. Next month, we will have another Sostento Live. That will be on April the 25th at 1 p.m. Eastern. That will be about strengthening our defense against future pandemics, as well as maybe a future variant. So we will be talking pandemic preparedness. That will be our topic of conversation. We will have a leader from an FQHC who is leading the way on preparedness, as well as a free and charitable clinic roundtable. So we also have some free and charitable clinics coming on and talking about what they're doing. So be on the lookout. We will be following up with an email with a recording of today's session. As well, next week, I believe, we'll be sending out invitations for our next session in April. So I want to thank everybody for tuning in, and I hope to see you at the next one. So take care, everybody.